Dick was a family doctor, well, they called them GPs in those days. And then he and Ernie Haynes came into the university hospital where they were running a clinic that was sort of a model of general practice in those days.
And he was my preceptor. He was the family physician for Devon, and then accepted a teaching position in the city. And he also was the team doctor for the Edmonton Eskimos. I first got exposed to Peter as an undergrad student because he was one of the few family physicians who ever gave lectures to students in the medical school.
He was very patient-centered. Peter really loved his patients.
One of the people that I knew, his name was Dr. Hammond Polak. He came to me one day and said, we have a $1 million grant, which in today's money is about $3.3 million. And that's when we started to design the family medicine center.
Gerald took on the department in the very early days of it being a department. And he was the right person at the right time.
He was a true scholar. He was a very honest man, and he kind of believed in what he was doing. I sat down and made the proposal for the primary care research network because it had to be community operated now, and said we want the guys to participate. And to my surprise, they all thought it was a great idea. And so they signed on and we developed this nascent research network.
Field notes, I would rather say, are just one of the possible tools of a qualitative approach to doing assessment in the workplace.
I think field notes in medical education may be one of the premier accomplishments of family medicine anywhere in the world. And they've revolutionized how we assess residents. And Mike Donoff was the brains behind that.
It bothered me profoundly that probably the most major department in a faculty of medicine to address the needs of the province of Alberta was relegated to being based in a hospital.
We were probably amongst the first faculties of medicine in Canada to actually have a rural family medicine rotation. In fact, a family medicine rotation of any kind.
I would certainly see ours as one of the largest programs across the country and has graduated the most residents. I think in part due to the fact we used to have the 6-month program and we're putting through more residents each year.
We do telehealth, and in Fort Chipewyan and Fort McMurray, Red Deer, there are residents that have gone to Red Deer and trained, and they're actually working there along with Lethbridge. So we're supplying most of Alberta.
It's also really important when I think that we have a pretty good understanding about the fitness to drive.
No question that is probably the most significant thing to happen to this department in 50 years.
And our research escalated because we were also able to hire PhD researchers as a complement to our faculty. That was, I think, the most impactful event in all of our history in terms of research.
I came here with a bit of a mandate to support the research program. And the research program here honestly didn't need a whole lot of support. It just needed the opportunity to show itself.
I just love that multi-sport environment, and also working with the physiotherapists and all the other people who are there looking after the athletes.
I was very proud of how our department handled it. We adapted very quickly. In particular, the residency teaching.
With COVID-19 and the social distancing protocols that we had to put in, that camaraderie, that mutual support wasn't the same as years past. So I think that when they came on to our rotations with care of the elderly, that was such a great opportunity for them to build those relationships.
I wanted to acknowledge all the administrative folks who are working in the department, because I think sometimes they're not acknowledged or recognized as much as they should be.
At the sites, there are secretaries that are leaders in how they help get projects facilitated and clinical staff. And everyone has a role in that.
So if you ask me our greatest strength, I would say it's the full-time senior management, almost like the department's version of the civil service.
Whether it be rural or urban, the community family physicians are the people who have taught. They are the ones that welcome the students into their clinics, welcome them into their communities.
And I think the department now has really evolved in a good direction. I think we are considered one of the top programs from a research point of view as well as from a training point of view in the country.
You talk to our undergraduate deans and they will tell you family medicine delivers on general medical education over and over again.
I think at the end of the day, we want to just make sure that we've made a difference. We've made a difference in our patients' lives. Being a family doctor really allows us to do that. Being part of the Department of Family Medicine really allows us to have that legacy piece of making a difference.
Family medicine isn't just seeing patients in your office, but actually family medicine has a wealth of knowledge and an area of expertise that other departments don't have.
We know the patients and they know us. So we have that to bring to the table. As well as that, we can deal with probably 80% of the things that walk in the door.
I think the program is going to do very well because we have great people. I think that's actually the biggest reason I'm so optimistic. We actually have great people that can problem solve.
I'm very pleased with what I see happening with the gender mix that we have in the department and the emphasis on various different groups in society.
I think as we continue to grow, there's a great opportunity for us to really just be a showcase department, as in the things that we're doing and how we can continue to just make healthcare in all of Alberta better, because primary care is the foundation, and with the folks that we have, I think there's real opportunities to change.